Electrode trauma, tier 2.
Hey guys, I wanted to make this video because I want to share a story with you of an experience that I had working as a certified phlebotomy technician or phlebotomist here in California, more specifically Southern California. It's a CPR story, so for those of you in the healthcare field, we all, or at least most of us, have to have a CPR card or a BLS card, but not all of us have had to use it. So I wanted to share experience of the first time I had to use it, and this didn't happen in a hospital or a controlled setting where you have doctors and nurses and defibrillators around. This happened in an outpatient lab here in Southern California in 2015. I was working my first phlebotomy technician job, or my first phlebotomist job, in an outpatient lab, and it was very busy. On this particular day, we were swamped. I would say we had 20 to 25 patients, in our waiting room, and there's 5 technicians there. It was really busy. But a patient came up to the front desk where I was registering everyone, and he kind of joked around. He made a joke or something that made me and my other coworker laugh, and it was funny. So we laughed and we kind of said, "All right, thank you, sir. I'll see you in a minute. I'll call you when you're ready." And so he went and he sat down in that waiting room, and everything seemed normal. But then he started to cough, and he was coughing really loud and really strong. And I had heard it, but I didn't think anything of it. I was busy. I was occupied. He wasn't my primary concern yet. And one of my other coworkers walks by the waiting room and she hears him coughing, and so she stops. She goes, "Sir, are you okay?" And the guy says, "Yeah, I'm fine." And I can hear him, and he says, "Yeah, I'm fine." And then she goes, "Okay." And she comes to me and she says, "Something's wrong with that guy. He's coughing." But again, we're busy. We're not thinking anything's about to happen. Well, a few minutes pass, and at this point, I've heard him cough a couple times, and my concern is a little more heightened. And so I see his paper and I register it and I put it, so he can be called, hoping that we can get him out of here, and hoping that he's okay. So my coworker goes, grabs the paper and calls his name. Outside of the waiting room, calls his name, because usually patients would just walk out once they heard it. But he didn't come out, and so he walks to the waiting room door. And he says, calls his name, and he doesn't answer, and he kind of looks at me sitting at the front desk. And so I'm already like, oh man, something's up. So I get up and I walk to my coworker, and we're looking at this man, and he's sitting in a chair looking like he's asleep, right? No other patients have got up for this name, so it's this man sitting there. And so I say his name, he doesn't answer. I walk up to him, I kind of nudge his shoulder. He's not moving, he's unresponsive. And so I look at my coworker and I say, "Hey, we need to get him on the ground. We need to start CPR." My coworker clears the room. Everyone leaves. I'm already trying to pull him off the chair so we can get him on the ground. My coworker helps me out. We lay him down, and I start chest compressions. And ironically, I had just taken my basic life support class for healthcare providers. I had just taken it in July, and this happened in October. So everything was still kind of fresh in my head. But this is the first time I've ever had to perform CPR. I've never done anything like this before. The most I saw was watching Grey's Anatomy or Scrubs, so it was very, nerve-wracking. But I remember to ask for a defibrillator, and I remember to tell everyone to call 911. And so my coworker calls 911. Another one goes to look for a defibrillator in the offices. We were in a medical office building, but it wasn't like a medical center, and it wasn't a hospital. It wasn't attached to a hospital. So my coworker runs, and I'm pumping the guy's chest for maybe a minute, which feels like an hour, and I can feel, as I'm doing compressions, I can feel his chest, kind of caving in, and I can hear his bones cracking. And if you've ever taken a CPR class, that they say, you have to have a good depth, and you might feel bones start to crack, and it's kind of because you need to get that depth to reach the heart and circulate the blood and move that oxygen through their body. And so that's what I was doing. And then my coworker comes back. She couldn't find a defibrillator, but she brought a doctor from next door. And this is a family practice doctor who hasn't been in an emergency room in years, probably. And so he goes, "Oh, what do we got?" And I said, "Man, this is unresponsive. I've been, doing CPR now for about a minute." And he goes, "Okay." He was very calm, which is nice to have him there. And he says, "Just let me know when you're done, or let me know when you get tired." So after about another minute, I say, "Okay, I'm tired. I'm ready to switch." And so he takes over, and I'm standing there, and his medical assistant had come with him, and she brought an oxygen mask with her. But when she tried to put it on the patient, she put it upside down. So I kind of, helped her with that. But it just goes to show you, when you're in this situation and your adrenaline's pumping and your blood's flowing, you're not really thinking about what you're doing, and you're not used to these emergency situations. And so paramedics finally get there after maybe about 3-4 minutes. We tell them, patient's been down for 8 minutes now. We started compressions. He wasn't responding. They asked, does he have an advanced directive or anything? And we don't carry advanced directives at an outpatient lab. And so they go ahead and they take over. They do their thing, and maybe after about 10 minutes they say, okay, I think we're ready to transport him. I guess they had got a pulse back. They said he had gone into full arrest, or cardiac and pulmonary arrest, which means everything just kind of stopped for whatever reason. And they transport him to the hospital, and me and my coworkers are there, and we're just all kind of shocked. We're phlebotomists, we're laboratory technicians, we work in outpatients. So if you were an inpatient phlebotomist, you might see code blues and traumas on a regular basis. But this being my first job, I had never witnessed this before, right? And at the time I was 20 years old, this is 2015. All my coworkers are experienced phlebotomists, but they're experienced outpatient phlebotomists. They haven't experienced things like this. So we're all shocked. We called our bosses and we let them know what happened. They said, okay, go ahead and close for the day. And so I went home, I picked up my girlfriend, I told her what happened. We went to go eat at In-N-Out. But while we're at In-N-Out, I'm just thinking, I'm sitting there like, wow, I can't believe this happened. This just happened, 2 hours before. And I'm thinking about the patient, and I'm kind of, feeling guilty. Like, we heard him coughing. Should we have done more? Should we have, got up sooner? Survivor's guilt. You always feel like you could have done more. Although we should never blame ourselves for things like this that happen, so suddenly. And so I knew the hospital he was being transported to. So I go ahead and I call the hospital and I say, is this patient there? And they say, let me transfer you to critical care. And they transfer me to critical care, and I talk to the nurse, and she's like, are you a family member? And I was like, no, I just, I performed CPR on this man earlier. I just wanted to know if he was there. And she's, yeah, he's here, but she couldn't tell me anything else because of HIPAA. So I said, okay, at least I had the peace of mind that he had been transported and he had made it to a hospital. And that's pretty much all the information I had. I believe 2 weeks later, he was taken off life support. He had actually had an advanced directive, but we didn't know because we were an outpatient lab. He did have a DNR. I guess this man had suffered various cardiac events, and he was actually there at the lab to have a D-dimer drawn, which if you're a medical professional, D-dimers are used to check for clots. So he had ongoing care with his cardiologist. This just happened to be his time, and that's all it was. So yeah, I tell this story because I feel like a lot of us have these stories, and I feel like it's good to talk about them. Like I said, my name is Eddie. I'm a certified phlebotomy technician. I'm a phlebotomist in the state of California, more specifically Southern California, and I'm starting this YouTube channel because I want to make a platform for allied health professionals. Allied health professionals are anyone who's not a doctor, nurse, or dentist in the medical field. So this is CNAs, EMTs, phlebotomists, MAs, dental assistants, x-ray techs. We're all allied health professionals, which is why I call this channel Allied Health Mentors. And so I want to create this platform. I'm going to bring out new videos. I'm going to talk a lot about phlebotomy because I am a phlebotomist, and I want it to grow. I want to bring on other people and other sides of the allied health field. And I kind of want to highlight what we do because, we are the unsung heroes of the medical field. Doctors and nurses deserve a ton of credit, but none of them can do their jobs without the support staff there. So if you like this, go ahead and like, subscribe. I think that's what you're supposed to say. Comment, let me know what you do in the medical field, and let me know if you liked it. Let me know if you had a similar experience. I'm going to read all the comments. I'm going to go ahead and respond to you as soon as I can. Thank you for tuning in. I appreciate it, and see you next time.